Hello, everybody. I know it's been a while since I posted a video. I've been busy. I got another credential or two under my belt I'll talk about in another video. But I wanted to do a comprehensive medical coding certification guide for nurses because I get a lot of inquiries from a lot of people who have questions about this certification versus that certification, and they really aren't sure what area they want to go into and what they want to pursue, and they just have a lot of questions. So hopefully this guide will give you some clarity. So first, we're going to talk about the requirements for the coding credentials, because a lot of people will ask, they'll say, I went to this website and it says you have to have this, says you have to have that. So you have to go back and read it carefully, because what they will say is that they will say recommended. For instance, like per the AAPC website, it says we recommend having an associate's degree, not required. This is straight from their website. Per AHIMA website, while not required, one of the following is recommended to sit for the CCS or CCS-P. So you see it says, while not required, it is recommended. So basically, as a nurse, you will be eligible to sit for any exam once you learn a few things. So I'm going to go into how a nurse will qualify by completing the following courses. So nurses already have completed anatomy and physiology. You've already completed medical terminology. You've already completed pathophysiology. You've already completed pharmacology. These are required for coding, regardless whether you're a nurse or whether you are non-clinical and want to learn medical coding. These are required courses. Also, reimbursement methodology. ICD-10-CM intermediate and advanced diagnostic coding. The reason why it is intermediate to advanced diagnostic coding for ICD-10-CM and for any of the code sets is because these coding credentials are not entry-level credentials. They are, if you read the material on the website, they are considered mastery levels or certifications. So you really have to have a very strong, I would say, high, intermediate to low advanced knowledge of the code sets, which you will have once you complete training. And also procedure coding, and that CPT slash HCPCS, which is outpatient, and or ICD-10 PCS, which is inpatient, and plus 1 year of coding experience. Now, there are a lot of nurses who think, oh, well, I haven't done coding. I don't know anything about codes. But a lot of nurses really indirectly work with codes, and a lot of us don't really know, because we do, every time you're at work, every time you document on a chart, every time you read a doctor's order, anytime you read um, any kind of reports, any kind of labs, that is considered chart review. And sometimes, depending on your setting, especially nurses who work in home health, even though you don't code directly, the clinical coders do interact with you about diagnoses. So all that counts as coding experience. Plus, while you're in school learning your code sets, that counts as coding experience. So nurses, like I said, have completed anatomy and physiology, medical terminology, pathophysiology, pharmacology, and so that already you already have that in the bag. You're good with that. So you just need to learn. Let me go to the next slide. And some of you already have had coding experience indirectly. So you have to complete reimbursement methodology and ICD-10-CM intermediate to advanced diagnostic coding course, and a procedure coding course, whether it is inpatient, which is ICD-10 PCS, or outpatient, which is CPT HCPCS. I'm not going to get into the differences between CPT and HCPCS right now, but I'll just give you very briefly. CPT is called HCPCS level 1. HCPCS is called HCPCS level 2. So it's just for outpatient strictly, and it's not that important right now. But once you take the class, you'll understand what the differences are in more detail. So now we're going to get into what exactly you can do with these code sets once you learn them. If you just want to work in, if you just want to do the ICD-10-CM code set only, let's just say you only want to learn ICD-10-CM, or you want to learn that first as the first step before you go into learning an outpatient code set, you are able to do that. They have certifications you can get. For AAPC, they have a credential called Certified Risk Adjustment Coder. That exam is 150 questions, multiple choice, and you have 5 hours and 40 minutes to take the test. Medicare risk adjustment, the certified risk adjustment coder will work in what you call risk adjustment. Risk adjustment is Medicare Part C, which they also refer to as Medicare Advantage, and also the Affordable Care Act, regularly known as Obamacare. They use the reimbursement methodology, of risk adjustment for their payments. And reimbursement for risk adjustment is based on the hierarchical conditions categories, or HCCs. It is a payment methodology that is strictly for risk adjustment. If you want to work in home health, BMSC is Board of Medical Specialties Coders. They have a home care coding specialist diagnosis credential, HCS-D. I just got that exam in May. I just got that credential in May. It is 80 questions. It's a 3-hour test time, and it is used exclusively in home health. Home health is its own little entity, and they do not recognize, even though you may have, for people who are certified, you may have a credential from AHIMA or from AAPC. They'll give you credit for ICD-10-CM coding experience, but they still require you to have the HCS-D credential. So if you are especially a registered nurse, and if you have any bit of home health experience, it would be an easy transition for you to just learn the ICD-10-CM code set, and you will be able to sit for this HCS-D credential. Because to work in home care, I'll do another video, but I'll briefly tell you, to work in home care coding, they require two credentials: the HCS-D, which is the one I just described, and the HCS-O, which is OASIS. And if you're a registered nurse and have worked in home care, you've done OASIS. So OASIS is another credential you have to have. But if you are a registered nurse, I've seen positions where if you have your D, they will give you like 90 days to get your HCS-O credential. Or you can, once you complete your HCS-D, you can study to get your HCS-O, and then you'll have both and you'll be ready to go. But for the purposes of this guide, if you just want to learn the ICD-10-CM code set, those are the two credentials that you can get just with ICD-10-CM. For outpatient coding, for AAPC, everybody's heard of CPC. It is 150 questions, multiple choice. You have 5 hours and 40 minutes to take the test. It covers Medicare Part B, durable medical equipment, and physician services. The only thing that I'm not really fond of with AAPC is if you have less than 2 years of verifiable coding experience, you'll receive the CPCA status on your credential until you have 2 years of verifiable employment. And as a nurse, I don't think that I didn't do it. I went and got my CCS-P, even though I worked at a job for like 2 years before I got my first credential in 2017, but I started working in coding in 2014. I had the 2 years experience, but I just didn't trust my job to be able to fill out the form after I passed my credential. Then I'd be stuck, because it has to be, you have to send it in on company letterhead and all this other kind of stuff. It has to be official, and I just didn't trust them to do it. So I went and got my CCS-P. But there are a lot of people who have their CPC. But I just want you to know, if that's the route you want to go, which you certainly can, and the code sets that you need for outpatient coding are the ICD-10-CM and the CPT/HCPCS. those are two separate code sets, the CBT and HCPCS. They're basically two books that you use to code in outpatient. That's really it. But going back to the CPCA, I just don't like it. And if you're a nurse, I don't recommend it. I just recommend you get your CCS-P because you have many, many, many other transferable skills that will make you more employable, and you just don't want that hanging over you. And if you do, then just be prepared um, to have to really, really sell yourself and just be willing to wait for an opportunity to come along. For your CCS-P through AHIMA, it is the equivalent of the CPC through AAPC in that it's outpatient. It covers Medicare Part B. It covers durable medical equipment. It covers physician services. Just like the CPC, you use the same three books for your exam. Except with AHIMA, their exam is 97 questions, multiple choice, and then you have to code 8 outpatient cases. The cases aren't really all that difficult. They really, really aren't. So I wouldn't be concerned about that. Once you complete your coding courses, your ICD-10-CM and your CPT, you should be able to handle any kind of outpatient case without a lot of difficulty. It's really not bad at all. And once again, it has a 4-hour time limit. Then there are a lot of outpatient specialty credentials you can hold as well, because there are a lot of nurses who work in these little niche areas of medicine. And believe it or not, there are a lot of niche areas of coding. Because I just put some here for example, as an example, but just for AAPC alone, they have 18 specialty certifications. Let's say, and I have some on the screen just for you to see, but what I found interesting is the certified obstetrics and gynecology coder. If you are a nurse and you work in OB and you just absolutely love it, why not go and get an OB coding credential? Because who in the world would not hire a nurse that has OB experience plus is a certified OB coder? It's just a win-win. And you don't have to be bothered with trying to find, especially if you have determined that you really love that specialty. Why not do it? Like, you don't have to worry about trying to find a job in another area of medicine or coding. You can stay right where you are and just open up a whole nother opportunity for employment for you. So we also have a certified evaluation and management coder. We have if you work at an ambulatory surgery center, um, that would be good for like if you even if you were a PACU nurse and you wanted to get away from PACU and you wanted to do outpatient, you could get an ambulatory surgery center coding credential because coming from PACU, you have tons and tons of experience. If you worked in cardiology, you could become a cardiology coder, or you could become a certified interventional radiology and cardiovascular coder. There are tons and tons of opportunity in coding, and you're not limited to just the standard certifications that you always hear people talk about. There is just as vast and broad as medicine is, and vast and broad as nursing is, medical coding is just as vast and broad, because in any specialty, anywhere you work, any time medicine, people are being taken care of, doctors are treating patients, nurses are taking care of patients, somebody is coding their encounter. So the hospital can get paid or the practice can get paid. Trust me. So if you are in one of those little niche areas, just consider an outpatient specialty coding credential. All of these credentials will just require you to know the ICD-10-CM code set and the CPT/HCPCS code set. It's just that they might delve a little more into like a certain area because it is a specialty, but you will be able to handle it. And all of these um, credentials have an accompanying study guide and a practice test before you take the full exam. And most of these exams, they also have 150 questions, and you have 5 hours and 40 minutes to test. If you wanted to work in inpatient, AAPC a few years ago jumped into the inpatient realm because they were purely outpatient. They had left the inpatient realm to AHIMA because AHIMA kind of is like the king of the hill. So, and AHIMA has their CCS has been the gold standard forever. But I'm going to talk about the CIC through AAPC. For your CIC credential, you only have to know the ICD-10 CM code set and the ICD-10 PCS code set because that is only used inpatient because AAPC already has an outpatient credential, so there's no need for them to incorporate the CPT code set into that exam. So you only have to know the ICD-10 CM code set and the ICD-10 PCS code set. This exam is a little different because they have 60 questions and they have 10 inpatient cases. And the inpatient cases, I believe you have to write, they're fill in the blank. So by them being fill in the blank, it takes them longer to grade your, because I don't, if you go for your AAPC credential, you'll take most of the exams are the Scantron. So you're just circling your answer on the little, little eggy thing. And then your sheet gets scanned, and that's how your test is graded. But for this exam, they have 60 questions that are multiple choice, but the 10 fill-in cases they actually get graded by hand, so it takes them longer for you to get your results. Most people, you get your AAPC results your exam results in a week. For the CIC, it takes longer because they have to once again grade your exam by hand. They have to physically look at it. And like I said, it's only used in inpatient. For the CCS, you will see that for under AHIMA, you have to know the ICD-10 CM code set, you have to know the ICD-10 PCS code set, and you have to know the CPT HCPCS code set. That's for the CCS. That is the reason why the CCS is the gold standard, and people say that it's the hardest credential to get because it is the only credential that tests you on all three major code sets. That exam, you have 97 multiple choice questions. You have 8 cases to code, just like in the CCS-P. But for the CCS, you have 4 outpatient cases and you have 4 inpatient cases, and you have a 4-hour test time. With the CCS, because you're tested on all 3 major code sets, you can work either inpatient or outpatient with the credential. And clinical documentation. Clinical documentation is a huge area of opportunity for nurses. Huge, huge, huge. And there are plenty of nurses who do not have a coding credential, but they have a clinical documentation improvement credential because you're not required to have a coding credential to get your clinical documentation improvement credential, but you have to know coding to get your clinical documentation improvement credential. So we're going to start with AAPC. AAPC started, they started the CDEO, I'm going to say maybe 4 years ago. It's relatively new. And it's only for outpatient. And that exam is 150 questions, and it's their standard 5-hour and 40-minute test time. And you have to know your ICD-10 CM code set and your CPT. And this exam you bring books for. Now, the AHIMA exam, their clinical documentation improvement certification is called the CDIP. And That's the credential I have. You have 130 to 150 questions, and it's a 3 hour test. I had 140 questions, and AHIMA does not differentiate between inpatient and outpatient. What they do is they have these documents called toolkits. They have an inpatient toolkit that you can, if you're an AHIMA member, period, you can download them for free. Or if you're not an AHIMA member, you pay $99. It is like the guide. It is like a step-by-step guide if you're working inpatient, doing clinical documentation, or if you're working outpatient. They have an outpatient one. So with CDIP, it's not designated to inpatient or outpatient. Now, when I want to go back to the CD to AAPC, AAPC just came out with another credential for inpatient credentialing because clinical documentation, because the outpatient is the CDEO. AHIMA has an exam that's in beta mode now called CDEI for inpatient. So now they're trying to give AHIMA and ACDIS a run for their money, because when you work on clinical documentation, the CDIP or the CCDS are the gold standards. And there are way, way, way more people who have the CCDS credential than the CDIP credential. I have the CDIP credential, and I do not recommend it because their study material for the CDIP exam is nothing like the exam. And fortunately, I was able to pass on the first try because at the time I took the exam, I had like 7 years coding experience and I had a clinical background, so I was able to get through. But their study material was trash. It's a disgrace. So I see why there are so many more CCDS credential holders as opposed to CDIP. And for the CDIP, you are not allowed to bring any books. For the ACDIS, you have to know ICD-10-CM because I have here the CCDS-O, so that's outpatient. They also have a regular CCDS, which is inpatient. So for outpatient, you have to know the ICD-10-CM code set, and you have to know the CPT HCPCS code set. And you're not allowed to bring in, the only book you're allowed for the CCDSO is a drug guide. You're not allowed to bring any coding books. So the questions that they ask you related to coding are very, very basic guideline questions. And even for the CPT, like when I took my CDIP, it was very, very basic coding guideline questions and it was only two out of 140 questions for procedures. And I would think that the CCDSO would be set up similarly, because the reason why you have to know coding and you have to know ICD-10-CM so well is because in inpatient, reimbursement is driven strictly by the ICD-10-CM code because they generate something called the DRG. And the DRG is ultimately what the hospital will be paid for that person's stay. There are a few other factors that get into it, but basically that's what gets the ball rolling. The inpatient, the admission diagnosis or the discharge diagnosis, it's the ICD-10-CM code that drives payment in inpatient. And I want to kind of circle back to when I talked about the risk adjustment and HCCs. There has been talk for a while, and I do believe that CMS, because CMS is like the largest healthcare provider in the country, CMS is trying to move everybody to a risk adjustment type or like an ICD-10-CM based payment method, because even just recently in home health, they changed to what they call a PDGM reimbursement model, which is very similar to a risk adjustment based model. So I think eventually, sooner or later, they're going to try to get these physicians to come off of fee for service, and go into some kind of risk adjustment ICD-10 CM based payment. So that's why you have to know ICD-10 CM, because as a clinical documentation improvement practitioner, you are really the liaison between the providers and the coders. So you have to know codes to communicate with the coders. You have to know what a working DRG is versus what a final DRG is. You have to be able to read the chart and be able to communicate with coders about coding discrepancies. You can also primarily work with doctors to, and well, not doctors, providers, to help them with their documentation, because as we all know, if it's not documented, it wasn't done. And in healthcare, if you don't document properly, you won't get paid for it. So that's why clinical documentation improvement is such a big deal, and that's why they are so heavily sought after, and that's why they are so well paid. You can make really, really good money in clinical documentation in any kind of institution. But if you work at a larger hospital setting, you make pretty good money. I mean, there are jobs on um, Indeed where you can make like well over six figures in clinical documentation. So um, once again, like the three are AAPC, AHIMA, and ACDIS. But I want to point out again, AAPC, they have an inpatient version and an outpatient version, as well as ACDIS. AHIMA only has one, that's the CDIP. And I want to say if there's anything else. I really hope that this presentation really, really kind of broke it down. And I really, really want you to just do some exploration. And I want you to really, really know you have options. That's really what I want you to know above everything else, that you have options. You don't have to be, I know that there are a lot of choices and I know it can be overwhelming, but I really, really want you to just take notes. I'm going to, at the end of the video, the next slide, I'm going to tell you, I'm going to link I'm going to have links to all these organizations in the description box. But I really, really want you to take the time and go and look and talk to people, do your research, go on Indeed, and just know that being a nurse, you are already like three-quarters of the way there. All you need to know, all you need to learn are the codes, the code sets, and reimbursement methodology, which is really not. The reimbursement methodology is, I think, one of the easiest concepts to learn. The code sets, you have to put in the work. It's time consuming, but it's necessary, because you're only as good as how well you code. You're only, it doesn't, you have to be able to produce. And coding is very detailed, and so is nursing. So it's a win-win. You're already three-quarters of the way towards towards a new career. You just have to learn the code sets and the methodology, and you can sit for your exam and go off into a whole new career. So I really hope, let me go to the next slide. So I really hope that this video was helpful. I ask that you please give this video a like and a share, and I ask that you please subscribe to my channel, and make sure you look in the description box for links to the organizations that I mentioned in the video. And I will see you all the next time I post.